Bismillah ar-Rahman ar-Rahim. My dear MRCS candidate, a lot of you, when they finish communication skills, they don't know if they have done good or bad because he doesn't know what is the right answer. He said, I got a patient, his biopsy was cancer, and I'm not sure what I have done. A lot of you, because it's not part of their curriculum during medical school, the communication skills, they don't know how to deal with such a situation. And sometimes the first instance you deal with a situation like this is during MRCS exam, like angry mother scenario, for example. You don't know what to do. Even if you got training, I have noticed that you do training with one of your colleagues. Neither of you know the basis of communication skills. And he said, well, I have been trained on the communication skills. This is wrong, and you need to correct your practice for communication skills. Someone would say, how can I do that? Well, I've actually created a software dedicated for this reason. It's called Vasai Communication Skills. So let me show you this tool, which is available on my YouTube channel membership. Let us say here is the application. You can see you got setting first, and you can put here your name, Muhammad Ahmed, and you can ask it to generate an avatar, or you can upload your picture. And here is the picture that is generated, and you go to the dashboard. The dashboard is created to have like a training module for you to understand how much you have practiced every week and what is your average score. And I've actually also put a tutorial for you. The spike system, how to break bad news, the S-bar system, how to do handover and safety. These are two tutorials, but let us go to practice scenario. Here is a practice scenario: breaking bad news, angry patient, consent for AAA, post-operative complication. All these are a module for you to be trained. How you can be trained? Here is, and you need to explain to a patient who is 59 years of age that he got a diagnosis of metastatic colorectal cancer. Okay. Once you start the station, you can speak to the application, and then it will reply to you as a patient and then give you an assessment, a detailed assessment. So what I will do now, I will play the role of a poor candidate. Okay? Doesn't follow the spike system for breaking bad news. And by the way, this program can run on your mobile, your tablet, and on your laptop. So it doesn't matter. If you just join YouTube channel membership for courses, you will get Vasai Communication Trainer tool, and you will have access. Let me give you an example of this station breaking bad news. Okay? Start the station. Good morning, Mr. John. How can I help you today?
Good morning, doctor. Please, call me John. I'm here because I've been feeling a bit off lately. Tired, mostly. And I've lost a bit of weight, maybe a stone or so, over the last few months. I'm hoping it's just stress from work, or maybe my IBS playing up again. My wife finally convinced me to come in.
I'm very sorry to hear about that, Mr. John. And I have news regarding your biopsy. Do you like me to explain it to you?
Oh, the biopsy. Right. Yes, please, doctor. Just tell me what's going on. I've been trying not to think about it too much, but my stomach's been in knots waiting
The
for this.
result came as there is malignancy in the colon, which means cancer, but we have a lot of treatment for this, and I would like you to digest this information slowly.
Cancer. Oh. Oh God. Tears welling up, voice breaking, cancer. Are you saying, how long do I have? My
Don't
kids, my
worry,
wife.
you should have a long lifespan because every day there is new modality of treatment of colonic cancer. But let us take it step by step. We need to do more investigation and then we start treatment as soon as possible.
A long lifespan. You really think so? I heard cancer and my mind went straight to the worst. Sniffles, so, what kind of investigations? What happens next? I just. I need to know what we're dealing with.
We need to do CT scan and the bone scan to assess the spread of the cancer. And we need to book you for operation as soon as possible to remove the original site of the cancer, then followed by chemotherapy and radiotherapy.
CT scan, bone scan, operation, chemotherapy and radiotherapy. That's a lot. All at once. It sounds very aggressive. You think it's already spread. That's why we need all these scans. Swallows hard, I was hoping it might be something simple.
I'm very sorry, this is too much information to digest at one time, but let us say that you need to have an operation to remove the original cancer, and after that, I will explain to you the next steps.
Okay, an operation first. To remove the original cancer. Right. Takes a shaky breath, so, you're saying, it needs to come out. Is it a big operation? Will I be in hospital for long? I have a lot of commitments at school, and my kids. I just need to get my head around this.
Yes, it is a major surgery, but we are one of the best center in the United Kingdom to get a good result. And after that, when you recover well, I will tell you what is the next step in treatment, and hopefully we'll do it by next week.
Major surgery, but you're one of the best centers, you said. That's good to hear. Next week, you think? That's very fast. I'll need to tell my wife, and my head teacher. Will I be able to teach again after this? How long will the
Yes,
recovery
you will
be?
be able to teach after this. Recovery is usually 2 weeks after the operation. By 1 month, you should be fully recovered and back to work and working normally.
2 weeks recovery, then back to normal in a month. That's quicker than I thought for major surgery. That's a relief. So, after this operation, what's the likelihood that it'll just be gone? Or will I definitely need chemo and radiotherapy too?
This will
You
depend
mentioned
on the
those earlier.
pathology report and how much spread of colonic cancer, but we can discuss this after you recover from the operation. And I'm really apologize, there is too much information to give you at one time.
No, it's okay, doctor. I appreciate you being direct, even if it's a lot to take in. So, the chemo and radiotherapy might not be necessary, depending on what they find after the surgery. That gives me a bit of hope. What about pain after the surgery? And will I have a bag? My neighbor had bowel cancer, and he
A
ended up with a
stoma is
stoma.
unlikely.
Is that
I
likely for
wouldn't
me?
think you should have a bag, and we should be able to do primary anastomosis. And don't worry about pain. We'll give you a very strong analgesia and patient-controlled analgesia after the operation, so don't worry about pain.
Unlikely I'll have a bag. That's a huge relief, honestly. My neighbor really struggled with his. And strong pain relief, that's good too. So, the next step is to get the operation booked as soon as possible, you said. What do I need to do now?
No, no
Do
need
I just
to
wait to hear from
do
you, or is
anything.
there
We will
paperwork
come
or
to you with
anything?
the date of the operation and the preparation. Just relax, take your medication, and if you have any question, you can contact me right away.
Okay. So I just wait to hear from you. That's good. No paperwork for me right now.
That you think I
It's a
can
lot to
recover and get
process,
back to normal.
doctor. Cancer, surgery, but knowing there's a
Said,
plan, and that you think
thank
I
you.
can recover and get back to
Thank
work,
you very
that
much. I
helps.
wish you all the best. This is
I'll
the
tell
end
my
of the
wife everything
station.
you've said. Thank you.
Now, this is the end of the station. Now, here is the beauty about this program. It will analyze my performance. A really accurate analysis. As you can see, I have failed in this assessment, and this is a comment. Candidate performance was significantly below expected in ST3 in general surgery. Breaking bad news scenario, primarily due to critical deficiency in clinical knowledge and empathy. Most concern failing was complete omission of the known liver metastasis, which meant patient was not given an accurate diagnosis or prognosis. This led to inappropriate and dangerously optimistic reassurance about long lifespan. I mentioned long lifespan, and this is not right. It's not always to say it. You see, this is the analysis. Not only this, but it will draw a chart, and this chart will show how much empathy you have done. You have 1 out of 5. How much structure in your answer, how much communication skills, and how much clinical knowledge and safety. And this is your map, correction map. And this is a comment about every point. Communication skills, empathy report and rapport, clinical knowledge and safety, score 0 out of 5. Structure 1 out of 5 for having a structure because I did not do spikes system. And it will mention the strengths. You have clear introduction, permission to discuss result. This was good. Use patient name, Mr. John. Provide clear next step and offer safety. This was a strong point in my answer. But area of improvement failed to mention known liver metastasis, which is in the scenario. Provided dangerous misleading information, too much optimistic. And this is very important. If you have patient with liver metastasis, don't tell that you have a long lifespan. Struggling to manage patient emotion. I was unable to control his emotion. Poor pacing of information and delivery. There was no system when I give information. Use medical jargon. I've used the term of chemotherapy, radiotherapy, which for the public doesn't mean anything. And overly optimistic statement. You have a long lifespan. This is wrong. Prioritize surgery for primary without adequate consideration or discussion to systemic nature. So these are the points that you need to improve. And these are the over result map of your performance. And this is why you fail. You have 4 out of 20. And believe me, this happened quite common to Egyptian candidates. So I've provided you with a tool. Now, this tool is not free with charge. You have to pay, unfortunately, because you are using artificial intelligence to reply. You can here retry the station, or you can have an export the report as well. And you can go back to your dashboard where you have all the station, how much you have performed, and so on. And you can benefit from having the tutorial. So this is a very useful tool for anyone who want to pass MRCS with the communication skills. This is not free of charge because artificial intelligence needs something called token, which you are not using it free of charge. So I have to pay for the token, and I have to pay also for the web hosting, which mean the server that will have this software. But all what you can do is join YouTube Vascular Online Training channel, go to membership, and join membership for courses. Here you will have plenty of courses for ATLS course, CRISP course, for MRCS course, under development FRCS course, Harvard course for medical education, and also you will see this particular course, which is called Vasai Communication Trainer course. Have it, try it, use it on your mobile or your laptop. Anytime you have time, benefit from this assessment, and hopefully you will pass your exam. I wish you all the best. My name is Dr. Muhammad Omar Farouk. I'm a consultant vascular surgeon and Royal College examiner of the Royal College of Surgeons of England. And also I'm a developer in multi-computer companies. And I wish you all the best.